This year in 2017, we are celebrating 60 years of successful allogeneic stem cell transplantation. And during this EHA meeting here in Madrid, we had a wonderful joint session between EHA and EMBT about this big anniversary, because this is really a huge achievement in the field of medicine, not only from a scientific point of view, but thousands of patients today who are cured thanks to allogeneic stem cell transplantation. So we had three giants in the field, Dr. Stob, Dr. Gluckman, Dr. Kolb, who actually very nicely summarized 60 years of achievement. So, for example, in the 50s, 60s, it looks very easy today, but engraftment was a major concern, and that was very nicely described by Dr. Stob. The evolution of the conditioning regimen, total body irradiation, switch to chemotherapy-based regimen. Huge revolution, 1978, and its validation, 1986. Introduction of cyclosporin and the cyclosporin methotrexate regimen for GVHD prophylaxis. Then in the early 2000s, we had the introduction of these so-called reduced intensity conditioning regimens, which opened the door to perform transplant in elderly patients with comorbidities. And now we do have long-term survival thanks to these reduced intensity conditioning. In parallel, we heard from Dr. Gluckman about the evolution of donor sources. The field started with HLA identical donors, brothers and sisters. Then progressively, the unrelated donors registries were created and developed. We have today, as of June 2017, more than 30 million healthy donors on the registry willing to donate to save the life of a patient somewhere in the world. Then, of course, introduction of cord blood, first successful cord blood transplant 1988, and more recently, the huge expansion of the use of haploidentical donors thanks to the introduction of the use of cyclophosphamide infusion post-graft infusion. At the same time, Dr. Kolb gave the history of donor lymphocyte infusions. Adoptive immunotherapy started like a sort of a soup in chronic myeloid leukemia, which is not anymore an indication for transplant, has been refined progressively, and now it has paved the way for all of these targeted cellular therapies, genetically modified field. And if I have to use the conclusion of Dr. Stob, highlighting clearly that when you consider a disease like acute myeloid leukemia, given the bad prognosis, actually allogeneic stem cell transplant is here to stay, but actually the next 10 years will be, the challenge will be for the next 10 years, how are we going to combine allogeneic stem cell transplant with all of the novel drugs and all of these novel cellular therapies. So this is really very exciting for the next decade.